Dr. Amit, we all know that cardiac health is one of the top killers amongst men. So, if the heart were to send a WhatsApp message to you, complaining about some pain or whatever, what would it be?
So, Shikha, as Dr. Ambrish rightly said, the number of cases of heart disease is rising, and more so in the urban world and corporate sector. So myself being in the corporate sector, so if my heart would send a WhatsApp message to me, that would probably be like, boss, can you have some fewer deadlines and more deep breaths? Most men, they underestimate the wear and tear due to the stress, poor sleep,
Right.
inadequate physical activity, and they sometimes ignore the early warning signs and symptoms of heart disease. And therefore, it is very, very important for every man that heart health is equally important. Like we see these days, many younger people also develop heart disease, and we have seen even many celebrities who succumb to these heart problems. And the corporate sector is realizing this, and the government is also realizing this. And recently in Karnataka government, they have announced that any person who has a heart disease, especially in a younger person, say less than 45 years of age, and if there is a death due to the heart disease or sudden heart attack or sudden cardiac death, then a mandatory autopsy is required as to what is the cause. Moreover, the government has also announced that corporate sector as well as the private sector employee should also get their annual health check done. So it is very important to listen to what are the subtle signs and symptoms of heart disease.
Right.
Heart doesn't sound, may not make much noise. Heart actually whispers. And listening to those whispers is, I think, the smartest investment that a man can make in his health.
So what will be that whisper through the WhatsApp message?
So through that WhatsApp message, the heart will say, can you take me to HCL Healthcare Clinic to get my annual health check done? Because if you know your health, only then you will get the permission to take charge of your health. I would say health is actually not a weekend activity, it's a habit.
Sure.
And therefore, as Dr. Mitra rightly said, move your body, have mindful eating, do some yoga, some biofeedback exercises, and then have fun. That your heart,
Absolutely.
and listen to your heart.
Lovely. And I think once again, very relevant points leave me thinking. But 2 points, and this is moving out of the script and asking you, Dr. Mittal. Dr. Amit used the word habit, making health a habit. Are you aware of the newly launched 360 degrees health and wellness app of HCL Healthcare?
Yes, I am. And I think I agree with Amit that it really has to be a habit.
Yes.
The only important point I'll add to it is it has to be a habit, ideally, inculcated in childhood.
Very true.
So the challenge is that our eating habits in childhood, if they are sort of encouraged to go on a certain track,
Yes.
then it's very difficult to change eating habits. Remember that in all chronic care, in all health issues, behavioral change is the biggest challenge. It's impossible to have people change what they've been following for years. So I completely agree, and it need not always be perfect. Small
Sure.
changes which look at everything,
Correct.
all the factors that I said, like in 360 degrees. I mean, all that makes a difference. Getting up from your chair while at work, every half an hour or so, practicing Pomodoro technique where you just go off your chair for 3-4 minutes,
3-4 minutes.
or even 3 minutes, just look out of the window, and then come back to your desk. All those little things add up.
Yeah.
And so I think having plenty of water through the day. So habits are, of course, ideally formed in childhood, but even later, if we modify one habit at a time, it's not that difficult.
Sure. So make health a habit and start this habit from childhood, and hence the name of the newly launched health and wellness app of HCL Healthcare is Habit Health. And this is integrated not only with health and wellness activities, but also a lot of engagement. And it is available for all our employees, the corporates that we partner with, their employees, as well as their dependents. And it's an app that you can use to play, develop habits, and of course, use the healthcare benefits. So that's the point that I was trying to make.
Absolutely.
That health has to be a habit, and habit has to start very early on in life.
Absolutely.
Moving on to Dr. Gautam, and I'm really sorry, some of my questions might feel as if I'm kind of, trying to bring in some humor, trying to roast the men, but well, this is
That's
my
good, man.
opportunity.
That's
So
good,
yes.
yes.
So men proudly boast about, their lung health. Okay, I have a huge lung capacity, etc., like mard ko dard nahi hota, वैसे lung capacity. But we've often seen that as soon as they start climbing stairs, just one flight of stairs, and they're I sometimes see it at home as well. So yes, so what is this gap between self-image and the actual reality? Is it some sort of, a non-belief, like Dr. Mittal just said, or do you actually confirm it to yourself but still don't want to accept?